All right. Let's see. Folks are starting to come on in, and I think we're getting ready to get started. And let me make sure I hit record. We're recording. Good evening, everyone, and welcome to another Beyond Access session. Before we get started, I want to announce that there are Spanish and Mandarin interpreters here with us tonight, working on separate lines. We will now announce instructions in Spanish and Mandarin for attendees who may wish to dial into those lines at this time. You will also be able to see video of the interpreters who are joining us here tonight. So we'll start off with our Spanish interpreters.
Por favor, marque el número 347-966-4114 y marque el PIN número 166401-759, dígito numeral. Una vez más, por favor, marque el número 347-966-414 y por favor entre el número de código 166401-759, dígito numeral. Gracias.
All right, thank you, Spanish interpreters. And now our Mandarin interpreters.
晚上好，欢迎大家参加本次会议。本次会议我们有提供中文普通话的翻译。如果您需要听中文普通话的翻译，请您拨打电话347-966-4114，然后输入会议的 PIN， 也就是密码750-118-503，井号键。你可以通过 Zoom 观看这个视频，同时通过拨打翻译热线听取中文普通话的翻译。请你将你的电脑屏幕还有你的手机调到静音，这样不会影响翻译的质量。再播报一遍，如果您需要中文普通话翻译，请您拨打电话347-966-4114，然后输入会议的 PIN， 也就是密码750-118-503，井号键。谢谢 ，Thank you.
Thank you very much, interpreters. Good evening again, everyone. As you all know, my name is Jose Rios Lua. I'm the Director of Family Empowerment and Communications for the Division of Specialized Instruction and Student Support. Tonight, as every night, all of our participants will be able to listen to this meeting via computer audio or by phone. You will also have the opportunity to ask questions throughout the session using the Q&A function in Zoom. We will check with our interpreters towards the end of the session to see if there are any questions in those language lines as well. If you're going to ask questions using the Q&A function and you're asking something that is particular to your child's IEP, we ask that you also include in your question either an email address or phone number or some way for our team to be able to get back to you in case we can't answer your question tonight. Now that I've shared some of the housekeepings for the session, I would love to introduce and turn the mic over to John Hammer, the Chief Executive Director for the Special Education Office, for some opening remarks. Good evening, John.
Thanks, Jose. And good evening and welcome to tonight's Beyond Access series. I'm John Hammer, Chief Executive Director in the Special Education Office, and we are so excited to offer these sessions as supports to our students and families during this unprecedented time. Our recent meetings have covered important topics such as literacy and executive functioning, a lot of great information on topics that will be discussed in even more detail in the weeks and months ahead. Tonight, we turn the focus to social emotional learning, a topic that is at the forefront for all of us. This pandemic has taken a tremendous toll on our city, and we need to pay careful consideration to our social and emotional health. The need to do that has never been greater. As I said, tonight we'll kick off our social emotional learning track and we'll focus on speaking with children about the pandemic, including students with intellectual and neurodevelopmental disabilities. In addition to the upcoming presentations on literacy and executive functioning I mentioned, we'll continue to present on social emotional supports in upcoming sessions as well. These dates are available on New York City Department of Education website. Jose will drop the link for those in the chat so you can come on back. Thanks again. Thank you for taking your time out of your very busy day to learn alongside of us this evening. And at this time, I'm pleased and honored to introduce Dr. David J. Schonfeld, Director of the National Center for School Crisis and Bereavement at the Children's Hospital, Los Angeles. Dr. Schonfeld has provided trainings for many of our schools, including schools in District 75, and has just been an incredible resource and partner to all of us at the Department of Education. We're so pleased to partner with him for these sessions and excited to pass it over to Dr. Schonfeld now to take us through the presentation. Dr. Schonfeld?
All right, well, thank you very much. And as way of background, I also did want to say that I'm a developmental behavioral pediatrician, so you can ask some general questions related to a range of developmental and behavioral problems as related to the topic. So our plan is that I'm going to be doing a series of presentations over the next 4 or 5 months. And I'm going to be starting out tonight with how do you talk to your children about the pandemic in a way so that they can understand it. That's the first step. And when we get to that together the next time, we'll talk about, okay, then if they understand what you're saying, how do they cope with that? We'll have another session on how to support grief and loss in children during the pandemic. And then we'll turn to how do families of children with special health care needs support each other within the family and cope with those unique challenges. And then we'll end by talking about self-care. How do you take care of yourself? Because you know your kids best, and you're one of the most important resources to them. So we want to make sure that you're doing well yourself. So in terms of let me start by sharing my screen. Call up the slides. And I'll show you what we're going to talk about tonight. So as mentioned, I'm at Children's Hospital Los Angeles, and you have my contact number if you wish to reach me on this first slide. So in terms of the outline, I'm going to first talk about the importance of helping children understand significant illness. That's whether it's someone they know is infected or ill with COVID-19, or just so that they can better understand the current pandemic and what we're being asked to all do and what you're asking them to do as well. I'll start by talking a little bit about how children come to understand illness in general, but I also want to focus mainly on how children misunderstand illness. Often we can say the right things, but kids don't always get it the way we intend. And so you want to be looking for those misunderstandings so you can correct it. And I think it's important to also recognize how understanding about illness helps children cooperate with both prevention and treatment measures. Because we want children to not only do what we ask them to do, but we want them to understand why they're doing it, and we want them to be motivated to do it themselves. And then I'll turn to some explanations about how you can explain COVID-19 to children. Now, throughout these sessions, both this evening and in the future, I'm going to be focusing on a broad range of disabilities that could include physical, intellectual, neurodevelopmental, and social emotional disabilities. So I recognize that the families that are on this presentation and will be on future presentations have children with a very wide range of disabilities, concerns, and special needs. And so that's why I want to leave plenty of time for questions and discussions so you can help me understand a little bit more about how to kind of shape my explanation so it aligns with what you need for you and your family. So this first slide is actually just for the adults. And this is some terminology. So I just want to go over some terms. I'm not suggesting you explain this to children, but I want to make sure you understand it as well. So first, the term is pandemic that I wanted to go over. So this is a disease which is prevalent or widely spread throughout an entire country or multiple countries, continents, or the whole world. And when it's the whole world, then it's a global pandemic. And that's what we're talking about. So that's just a disease that's widely spread throughout the entire world. The name of the disease in this current pandemic is called coronavirus disease 2019, or just COVID-19 for short. The CO for COVID stands for corona, the VI stands for virus, and the D stands for disease. So you can just call it COVID-19. The virus that causes COVID-19, though, is named differently. And that's actually the SARS coronavirus 2, or SARS-CoV-2. SARS is a severe acute respiratory syndrome. And SARS is caused by SARS-associated coronavirus, or SARS-CoV. Now, that's very complicated, and so I'm not suggesting you review this with children. And so I would recommend you just refer to it as COVID and also the virus or germ that causes COVID. So I just wanted you to have the terminology in case you read about it in the newspaper or through other media, they start talking about coronavirus. I'm just going to call everything just COVID and the germ that causes COVID. So let me first start with, why do we even want to discuss this with children? And the reason for that is parents and other adults really need to inform children about illnesses that affect them. That could be an illness that the child or someone close to them has, such as a family member or a friend, or if there's reason to be worried about getting the illness, they should also be informed about the illness. So for this presentation, I'm going to focus on talking with children about COVID-19 when the child or those close to the child is not infected. So it's really about giving general information, but you're welcome to ask me questions about what to do when someone is infected as well. Given everything that's going on, it's virtually impossible to keep this information from children. Even very young children can sense when something is wrong and upsetting their family members and others in their lives. And even if you try and protect them from this information, children are generally going to find out from other sources. I did some work in Colorado after they had the shooting in Aurora that had occurred during a midnight showing of the Batman movie. And I was working with the school, and we were talking about how were we going to speak with the children when they came back for the first day of school. The shooting actually happened during the summer, so there were a number of weeks that had passed. But we decided we wanted to start conversations in classrooms on the first day so the kids knew that they could talk to someone if it was upsetting them. And there was some discussion about at what grade level would we start this. And I remember being at a press conference and the superintendent got that question from a reporter and said, well, we didn't really discuss that. I'm thinking maybe second or third grade. And then he looked at me and he said, I can tell by the way David's looking, maybe he has a different view. And I just said, I think even kindergarteners have heard about Batman. And he said, that's a good point. We will start in kindergarten. But there were some staff who thought that that was too early to start having the conversation with children who were developmentally about 5 years old, particularly on their first day of school in kindergarten, the first time they were coming to the school. But one of the staff told me, and she said I could share this with people, that her child was about to start kindergarten and she didn't think her child should be told. So she kept the television off during that summer. They never talked about the shooting that had happened. They didn't have conversations that the child could overhear. And they thought they were successful in that. Except one night, several weeks later, they were just talking at dinner and they suggested going to see a Disney film. And the child just spoke up and said, I don't think we should do that. There's people shooting people in movie theaters. So they asked the child, where did you hear that? And he told them that when he went swimming in the public pool, another child swam up to him and told him. Now, what really upset the parents the most about this was not only that their child had found out, but their child didn't speak to them about their concerns because the parents never talked to them. So when you don't talk about it with children, children pick up that you're not comfortable, and so they don't talk about it. And I will tell you that even children who have significant developmental disabilities, who may not be able to fully understand what they hear, may still become highly concerned. So we saw, for example, after 9/11, children who had autism spectrum disorder and had really major problems with communications and developmental abilities were still worried. And even children who didn't relate very well socially to people actually started talking about worrying about other people. And so what you'll find is that they'll pick up on the concerns. And quite honestly, knowing that something really bad and scary has happened, but not knowing what it is or how to protect yourself is actually even more frightening than knowing what has occurred. And that's because children, just as adults, are better able to deal with a situation if they feel they understand it. And the key point there is you want them to feel that they understand it. They don't have to understand everything. They just have to feel they have some understanding. The amount of information to provide to children depends in part on their age, their level of conceptual understanding in general, which I'm just going to refer to as their developmental age, their personality, and their typical coping style. So for some children, they're better able to cope if they understand more about the situation, whereas for some children, they actually just become sensitized and anxious if you give them more details about something they can't control. And again, you know your kids well, so you'll know where they fit in that spectrum. You know, is it that they get highly sensitized and anxious the more you tell them, or do they start to feel they can master it if they understand more about it? Older children and adolescents generally want and can benefit from more information, but really, no matter how old children are, it's best to start by stating in simple, direct, and clear terms just the basic facts. Then ask the children what questions they have and what further information they would like, and take your cues from their questions. And quite frankly, if you can say something simply and clearly, there's really no reason to ever choose to say it differently. Particularly in the setting of a serious illness or a newly discovered illness, and COVID-19 is both, even very well-educated adults may have trouble understanding or processing information effectively, so we should always start with simple explanations and make sure that kids understand that before we tell them any more information. Now, while it's important to inform children about illnesses, you should concentrate on sharing information that's relevant to them. What do they need to know so they understand it and know what to do? You don't have to share every detail. I don't actually think it's even helpful for the general public and adults to know everything and all the information that's in the news. I remember speaking to a surgeon before I was going to have surgery, and he started going through the detail for the operation. And I eventually just got to the point where I was like, you know what? I'm not going to be able to fill in for you if you become sick that day. So as far as I know, I'm going to be asleep and unconscious while you're doing that, and I really don't need the details. But I think there's this tendency for us to tell people everything because we think then if they understand everything, they'll be better. But the goal is really just to help them learn what they need to do to keep themselves healthy and to feel safe. And don't try and cover everything in one session. You're just starting a series of conversations that we expect to continue over time, and you just want to start the process off to a good start. Now, comprehension also helps children and it gets their support in taking the steps to prevent catching or spreading the illness. It helps them to understand better what they should do and what they shouldn't do, why it's important to do it, and also how do you do it most effectively. So let me go over then the process by which children do come to understand illness. In this process, children's understanding of illness in general develops as a result of both maturation, they get older and more sophisticated in their understanding, but it's also because they gain more experience. And some of that experience deals with education and the explanations that we provide them as they accumulate that experience. It isn't just that they gather more facts, though. There are important differences in the way they see, interpret, and come to understand illness at different stages of their development. So let me go through a little bit on that. So very young children tend to rely on what we call magical thinking. This is the belief that their thoughts and wishes can cause things to happen in the world, and that makes them feel more powerful than they actually are. And that helps young children because otherwise they'd feel very vulnerable in the world. And it works well when things go well. It is a problem when things don't go well, like somebody gets seriously ill. Children tend to believe, particularly when they're young, and we continue to believe that to a certain degree, even as adults, that good is naturally rewarded and misdeeds, even if they're only thought about, may be punished. And they may then come to view illness as a form of punishment. So you'll see even adults will talk about the fact that they don't understand what they did to deserve being sick or getting a serious illness. There isn't any reason that you should feel that they do deserve it. But it gets back to this magical thinking that you get sick because you did something wrong. And that's often what we reinforce, unfortunately, in some of our conversations. Now, those type of beliefs around magical thinking result in guilt and shame being associated with illness because children view treatment as a form of punishment. And that's only made worse by threats from parents that if children don't take their medicine or follow certain instructions, they're going to be taken to the doctor or the hospital to get a shot or some other unpleasant treatment. As a pediatrician, I hear that all the time. We'll ask the child to swallow something or to do something, and if the kid resists, the parents will say, well, if you don't do it, you're going to get a shot. We don't give shots to punish children. They don't get them because they did something bad. We give it to them because it's something that they need. And so we really don't want them to see it as a form of punishment. When we get frustrated instead and threaten children in that way, it just makes them less likely to share when they think they have symptoms of an illness or to cooperate with the treatment that we ask them to do. And so we want them to come forward when they're concerned about their health without feeling that somehow we're going to punish them for it. Now, after children start to develop a more accurate understanding of the cause of illness, they will start to understand that illness can be contagious. It can spread from person to person. But this is initially overextended to conditions which aren't contagious. So they overextend contagion even when that isn't the case. By about 9 or 10 years developmentally, children believe that germs must first enter the body to cause illness, but they're usually not able to explain how germs actually cause illness once they get into your body. And by about 12 or 13 years of age developmentally, so pretty late, is when children begin to appreciate it, all the complicated interactions between the host, which is the person who gets ill, and the agent, or the virus in this case, as the cause of disease, and understand how recovery occurs. So it's not often until at least adolescence, developmentally, when children can figure out how unrelated symptoms like a sore throat and a rash or different stages of an illness are all really part of the same disease process. It's during adolescence that they begin to develop a better understanding of what happens inside the body during illness, and that makes them more capable of understanding how a lot of treatments work that we take for granted. Like, why would you swallow medicine to treat an infection in your ear? Very young children will think you should just put it in your ear. They don't understand that when you swallow the medicine, it gets into the bloodstream and that travels to the part of the body that's affected and how that actually works, because to be honest, it's quite complicated. So when we're working with children who are quite young or children who have limitations in their ability to understand, sometimes we try and make things what we call more concrete. So if you're going to give them something, give them a shot in their arm to treat pain that they have in their stomach, maybe, or belly, you might also give them a heating pad because you put the heat right where it hurts. And that makes more sense to children, have more limited understanding of the treatments. It's the same way if we're giving them medicine. Sometimes stronger medicine is in smaller pills or more concentrated liquid. And sometimes we have to give them 2 pills to let them know we're giving them twice as much medicine, even though you could give them just a stronger dose. So you want to think about how they think about illness and the treatment, so you make sure that you can help them feel like you're giving them the support that they need. So that's the general process by which typically developing children come to understand illness. But let me turn now to how they misunderstand illness. How do they get it wrong? Because those are the things you really want to be looking for. Children, and I will say even adults, may have very limited understanding of illness based on a number of related factors. They may have limited information, misinformation, they were told something but they got it wrong, misinterpretations, or misconceptions. I'm going to go over each of those. So first off, limited information, that's pretty simple. They weren't told. And so you can fill in that information and help them when their misunderstanding is based on incomplete information. But they can also have misinformation. Somebody told them something that was just incorrect. And we're seeing a lot of misinformation in what's being communicated to both children and adults during this pandemic. You also can have what are called misinterpretations and misconceptions. Let me just explain what that means. They may have been told correct information, but just misunderstood it, either because they got the facts wrong, or they might have understood the facts, but just not put it together with the right concept. So let me give you an example of misinterpretation. I was taking care of a child in the emergency department who was about 8 years old, and she had sickle cell disease, and she came in with what we call a painful crisis. So she was in a lot of pain. She was treated appropriately with IV fluids and given pain medication, but she continued to become very distressed. And I won't go through the whole story because it actually took me about 4 hours to figure out. But she became very distressed and agitated because she really worried that something horrible was going to happen. And after spending some time talking with her, I found out what that was based on. When she was in kindergarten a couple of years prior, she had a friend who she said just passed in the middle of kindergarten lunch period. She said that she died because the child had sickle cell disease and her mother didn't get her treatment fast enough. And she was always worried that that would happen to her as well. But as we talked some more with her mother, with her alone, I realized what had happened was her friend hadn't died. Her friend had actually fainted. She was taken to the nurse's office. She didn't come back to school because it was the end of the school year, and she switched schools after that. But the child thought that her friend had passed and confused passed out with passed away. So she had just a misinterpretation. The word that was used just was a little complicated for her, and she confused them. And this happens all the time. And once I explained to her that her friend wasn't dead, she just attended another school after she had fainted, she sat up and she said she was feeling fine and didn't need any more treatment. So sometimes kids get it off just a little bit. You say something and they don't understand it quite right, and that causes distress. Sometimes they understand what you've said, but they don't put it together properly, or they just have a different understanding, what we call a different concept or a misconception. So I was taking care of a child who was about 12 years of age, and he had sickle cell disease, and he was admitted into the hospital. And he was there for about 5 days. He was having some dizzy spells, and they thought he might be having small strokes, what we call transient ischemic attacks, because of his sickle cell. And while I was talking, and I was sitting with him and talking with him one day, he just looked at me and he said, "You know, I'm the oldest." And I said, "The oldest what?" And he said, "I'm the oldest kid with sickle cell disease." And I looked at him and I asked, "Do you mean in the world?" And he said, "No, but I know I'm the oldest in the clinic." And so I looked at him and I said, "What do you think happens when you get older?" And he said, "I suppose you die." And I said, "Well, you're 12 years of age. And at this point, we transfer children with sickle cell disease to the clinic and the adult hospital across the street when they reach 13. I said, "You're not going to die, next year. You're just going to go to a different clinic across the street." So he looked at me very surprised. He said, "Are you kidding?" And I said, "No." And I introduced him to an 18-year-old who had sickle cell disease, who was also in the hospital. And they met for a brief period of time. And then he came back and he told me he was no longer dizzy and he was ready to go home. So that hospitalization of almost a week was just because he had a misconception. He just didn't understand that actually there are older children and adults with sickle cell disease. So getting it off just a little bit can actually cause a lot of distress in children, particularly when it's about something that's serious. And COVID-19 is serious for some people. There are many examples of misinterpretation. For example, type 1 diabetes, or the diabetes that requires insulin, does lead to an increase in blood sugar, but it isn't caused by eating too much sugar. And that's what some children will believe. So they understand part of what it is, but they mix it up a bit. And that'll cause more distress, particularly if they're eating a lot of sugar and they think they might have gotten diabetes. So I just want to go over a little bit about how those illnesses, how those understandings and misunderstandings of illnesses can complicate things for kids. But there are other ways that children's understanding of illness is limited. And one of them is what we call overgeneralizations. They may take what they understand about one illness and just apply it to another illness when it really doesn't work that way. So as you explain to them about COVID-19 and the pandemic, they may actually overgeneralize that information to other illnesses or conditions which are not as serious. So for example, they may assume that other potentially serious illnesses can be spread by coughing or sneezing when they're not contagious. Or they may think that other illnesses that cause breathing problems or cough may actually be much more serious than the illness really is. Now, all of this suggests that we have to look for what they misunderstand. And one of the things which I don't know that everyone recognizes is presenting correct information often doesn't correct pre-existing misconceptions or overgeneralizations. For some reason, individuals can hold two things to be true, even when they both couldn't be true, if they're conflicting information. For example, many adults will warn their children that they might catch a cold if they go outside without a jacket. And really, actually, colds are caused by coronaviruses and rhinoviruses. They're infectious diseases that are spread from one person to another, and it doesn't have anything to do with being exposed to cold air or cold weather. Now, I've seen that misunderstanding even among pediatricians who clearly know how these illnesses are caused. And I remember at one point just challenging them, and I said, so you wouldn't allow a child to go outside because it was too cold outside, and you'd make them stay inside. But you know, they're much more likely to catch a cold from someone inside. As we've seen in the pandemic, these respiratory illnesses spread more between people when they're indoors, not when they're outside. And so I said, it's actually the opposite of what's true. And they would just look at me and go, well, I kind of understand that, but that's what my parents told me. I said, well, your parents may have been mistaken, but you do know better. The bottom line is they actually believe both to be true. So they know how to treat the condition and give advice based on medicine that they know, but they also follow the advice of their parents, particularly with their own kids. So our explanations have to do more than just kind of share facts. We can't just tell them what to do and what not to do and expect them to memorize it. We actually have to help them understand why, at least at a very basic level, so they can figure out what they ought to do. So we can explain to young children or older children who have, say, intellectual disability, that COVID is caused by a specific germ. Only the COVID germ causes COVID. And the reason I'm going over that is sometimes kids will just think germs cause COVID. And if they need to wash their hands before they eat so they don't catch germs, they may think that if their hands are dirty, that's a way to get COVID. And you have to explain to them that only the COVID germ causes COVID, and it can be spread from a person who's already infected with the germ to another person. The germ is found in the body of people who are infected and can spread when the infected person coughs, sneezes, or breathes on another person. When people cough, sneeze, or breathe, they spread a small amount of water from inside their mouth and airways where the germ is found if they're infected. And you can demonstrate that by having children cough into their hand and feel the moisture. When this water that has the germ gets on other people's hands and they then touch their mouth, nose, or eyes, they can allow the germ to get into their body through those openings. People who are infected with the COVID germ and virus may have a cough, fever, or trouble breathing, but they can also feel sick in some other ways. But many don't feel ill, but can still spread the germ to others. And that's why we wear a mask, and we keep farther apart from people who don't live in our home, and we wash our hands carefully before we touch our food or before we touch our mouth, our nose, or our eyes. And that way people who are infected don't spread the germ to others, and we don't catch the germ from them if they are infected. People who have COVID usually get better, but some can get very ill. Older adults or people who have another illness that makes it harder for their body to fight off the germ are actually more likely to get very ill. Fortunately, although children can get infected, they're just much less likely to get seriously ill, and many times they don't even feel ill when they're infected. But as I said already, they can still spread it to others even if they don't feel sick. So it's important that even children follow these steps to prevent from getting infected or to unknowingly spread it to someone else. It's also important to reassure children because they're going to overgeneralize. So you tell them that many different illnesses can cause a cough, fever, or trouble breathing, and most of these are fortunately not serious. If someone gets one of these symptoms, they may go to get testing to see if they have the COVID germ or COVID virus. It's also important to remind them that once someone has recovered fully from COVID, they actually no longer can spread the germ to others, and then it's safe to be with them. we see a number of times that even adults are afraid of catching the illness from someone who was infected, months prior. And there's actually a lot of shame associated for some people who have become infected because other people don't recognize that. Now, we now have vaccines that can keep people from getting ill with COVID, but we don't yet have enough made for everyone. And we hope that by the spring or summer, most, if not all adults in our country can get the vaccine. And they're now testing the vaccine for children, so hopefully there'll be a vaccine that children can take when the testing is done. So I went through what an explanation might be for a child, and that's, I think, a good starting point on how to have the conversation with children. So what I wanted to do now is I'm going to stop sharing my screen so that I can answer some of your questions. So please add any questions into the question and answer box. There's actually a chat box. You should enter the questions in the Q&A site. And I think you can also, you may be able to ask the questions directly of me as well. I'm going to pause now and I'll turn this over to Jose.
Yeah, absolutely. So as Dr. Schonfeld was saying, if you all see on your screen, there is a Q&A icon. There should be a Q&A icon with a couple of little speech bubbles. So if you click on that, you can type in your questions. I know that folks have questions in here. I see a couple of names in the attendees list of folks I know very well. So yeah, feel free to start typing those questions in. And as folks are typing those in, Dr. Schonfeld, I wonder if you have any thoughts or suggestions around conversation starters for families with these. Like, I know that I've heard a lot from families that they've seen a particular episode from Sesame Street that speaks towards the coronavirus, and so they decided to watch the episode first and then have a conversation. So do you have any thoughts on conversation starters or techniques to shift into that?
Sure. So yes, you can hear about it on in television shows. You can have information to share about someone who's worried about it, or information, for example, about school being closed for a period of time, or hearing about a relative who's quarantined. And you can use that to start the conversation. But to be quite honest, you can just start the conversation. I mean, this has been in the news so much and has affected so many people. Your children are at least aware at some level about that there's something going on. I've had situations, I talk to a lot of families who have had some very serious illnesses, and sometimes they've gone years without telling their children about it. Because their children don't yet have serious symptoms. And they ask, how do I start the conversation? And I just tell them, just say you want to talk about it. Just start the conversation. You could, for example, just say, I went to hear somebody talk about how to talk to kids about COVID-19, and I thought it would be a good idea to find out, what do you understand? Or what questions you have. I tend to just be very honest and direct with my kids. I was actually once writing a curriculum for elementary school kids about a particular serious illness. And it was in the middle of kind of an epidemic that had started. And I turned to my daughter, who was, I don't know, she was in elementary school, early elementary school at the time. And I said, dear, could you tell me, what do you know about this? And she looked at me and she said, you don't know what causes it? And I said, well, yes, I do know what causes. She knew I was doing research in that area. So she said, well, why are you asking me if you already know? And I said, I want to ask you because I want to know what you understand. I think the best way to do that is if you explain it to me. And she just said, okay, that makes sense. And then she explained it to me. So I would say you don't have to look for an excuse to talk to your children about something that's important in their life. I think that's kind of wasting time, to be honest. I think you sit down and you tell them, because you want them to know if there's ever anything really important, you're going to talk to them about it. And you don't want to wait until Sesame Street does a show about it, because that means you've waited a really long time. It takes a while to write the show, film it, and broadcast it. And I think it's useful to tell kids right as it's happening, so that what you know, they know you will share with them if it's important.
Thank you. So there's a couple of questions coming in now, and here's one that I'm saying is, can you speak about how to speak to a teen that understands about COVID-19 and feels his life has to stop? An example here is like celebrating Christmas or even having a play date or hanging out with friends outdoors.
And we're going to talk more about this, but when the person says he feels like his life has to stop, sometimes children become overly concerned. And this is a concerning illness, but they may feel that everything has to stop. I have heard of some situations where children have not even been willing to go outside in their yard for many months. And if your child has a social emotional, like if they have a social emotional disability and severe anxiety, there may be situations where kids, I don't want to say exaggerate, but are more worried than they need to be about even relatively safe practices. And so if they feel their life has to stop, and you're saying it really is, I mean, there are things we can still do, but we have to be careful. Then I think what you need to do is make them understand really what's relatively safe. And I'll go over more of this next time. What are the things, what are the steps we can take that will keep us pretty safe? And it's not going to prevent all illness 100%. We can't do that, unfortunately. But we can take reasonable steps to keep ourselves safe. This is how it works. This is why we should do it. And then you encourage them to start to do more things. Now, that may also mean that because of the restrictions, it feels like their life has stopped. And they're really upset about the fact that they want to do more. So I'm not exactly sure how the person means that question, but it may be that they feel like they can't do anything, and that it's unreasonable and unfair and the risks are exaggerated. Now I'm going to go over this on the next session. But I think what you do is you kind of first ask them, what is it that you want to do and why do you want to do it? And then you try and problem solve with them. How can we get closer to that? Maybe it's that you can't have a friend over to play inside the house, but we can walk somewhere where the friends, 6 feet apart and you're both wearing masks. Maybe that's going to be okay and you can accept that. There's certain places where it's safe to go, relatively speaking, if you have a mask on well, and other times you may disagree within your family. I know I've done things with my family, and there'll be like 4 of us, and we're meeting one of my older daughters who lives in another household, and we'll just have a conversation. What are we going to do and not do? They want to go walk here. I think it's really crowded there. I'm not comfortable with that. And we just made a deal that whoever is uncomfortable wins. Like if we're starting to walk towards some area where there's a crowd and one person says, I'd like to cross the street, we listen to that. That's part of how we respect each other, is we say, look, you may not be as concerned, but we're all in this together. So if you're concerned, I want to meet that concern for you. But if you have someone who's, I remember talking to one family, the dad actually, I think, has an anxiety disorder, and he would not allow his spouse or his child to even take the trash outdoors. For like 3 months, they weren't allowed to leave the house. And, then you have to kind of say, all right, that's not doable. We have to kind of balance your concern. And I'm going to go over this more next time. Part of it is if children say, you're making me stop my life, then part of it is, I wouldn't try and dismiss that or minimize it. Yeah, it feels like that. This is pretty overwhelming. And yes, there's a lot of things we have to give up. So let the child say it, hear it. I know that can be really difficult. And then talk with them about how to cope with it. There's a tendency for us to tell them, I haven't stopped your life. I've just told you you can't leave the house. You can't meet with your friends. You can't play with your friends. And they're going to say, and that is stopping my life. And and if you say something like, yeah, but I'm still letting you live, I don't think that's really hearing your child. So hear what their concern is and try and figure out how you can do something that will get closer to what they're looking for, but still keep them safe.
We have quite a few questions around having conversations with nonverbal children. Do you have any resources or ideas around using symbols or visual instructions or prompts for nonverbal children?
So for kids that have some difficulty, particularly children with autism spectrum disorder, for example, they often have trouble understanding and learning new routines. And so then we have what we call scripts, where we help them practice putting a mask on. We do it in stages. We do it before they have to go outside. You can show that script in visual pictures. You can show pictures of someone putting on a mask, of going next to someone else and not shaking their hands, of washing their hands after they touch something. So you can give them these visual cues in order that kind of tells them a story through pictures. So they understand more what's expected of them and what they can do to be safe. I think it's difficult to explain some of what I went through pictures alone. And if your child is not verbal and has limited understanding, then you might just aim for them to understand what you want them to do, and what they shouldn't do. So they have to put a mask on. They stay a distance apart from people. You may not be able to explain the virus gets into the body and causes illness and it spreads in moisture. That would be more detail than you would use with a nonverbal child or child with limited understanding. For those children, I would focus more on the steps that they need to take to stay healthy and appreciate the fact they may not be able to understand it to the same degree, but you at least want them to know what the expectation is.
You kind of got to it a little bit here in your response, but can you talk a little bit more about, we've talked a lot about the importance of having conversations with children, but can you talk a little bit about the importance of parents modeling behaviors for their children? Like you talked a little bit about meeting a person and not shaking their hand and those kind of things.
Yeah, so yes, children do impart what they're told, but they also do a lot of what they see. And so you want to show them how you practice the behaviors, and you can explain why you're doing it. I remember very early in the pandemic, before things really started to close down, in our hospital, we actually made it a no handshake zone. So we had signs up saying, we don't shake hands here. We still care, but we are not going to shake your hand. And I remember being in clinic and, parents would reach out to shake my hand when I walk in the room. And I would just say, I'd really like to shake your hand, but I don't actually do that now because we're trying to prevent the spread of germs, because there have been some cases of this coronavirus in China that we think may be spreading here. I live in California, so we were one of the places that had infections early on. And parents would just look at me and they would go, thank you so much for being concerned about our health. And I'd say, there are many ways that I can show you I'm still welcoming you to the clinic and like to be with you. That was, of course, before we went to most visits virtually. And kids will tell you, you're telling me to do one thing, but you're not doing it. Even if they can't say that, they do think that if they observe it. So a perfect example, I remember once getting really upset with my kids. We were in the car and the situation was I needed it to be quiet for safety reasons. And they were making a lot of noise in the back seat, mainly from playing. They weren't doing anything bad, but they were making a lot of noise. And I just, kind of said back to them, please be quiet. But I said it loud so they could hear me. And they just started laughing and they just repeated back, yes, let's be quiet, loud back. And I realized that did not work. I probably should have said softly, please be quiet. instead of said it loudly. I mean, I said it because they wouldn't have, I didn't think they'd hear it right away if I was too soft. But kids will say, you know, you tell us to do this, but you do, you know, you've done it different. We've seen that with political leaders now, where I can tell you in my own state of California, the governor, you know, I think did a very nice job in many ways early on in the pandemic in particular, but he, you know, said that you shouldn't get together in groups. And then he was seen at a dinner with a lot of people to celebrate, you know, somebody's anniversary on a job, I think something like 50 years or something. And there's now an effort to recall him from being a governor because he was telling people what to do, but he wasn't doing it himself. Well, if we can hold governors accountable, trust me, kids will hold parents accountable. So I think they learn better when we model it. If we model kindness, they learn kindness. If we're unkind and tell them to be kind, they learn to hide what they do that's naughty from us so they don't get in trouble. So we really should be showing them through our actions, but we should also be explaining it. Because if kids will observe a lot, but they may not really understand exactly what you're doing and what's most important. So you need to do it and you need to tell them why you're doing it and then invite them to do it.
Thank you. I think we have time for a couple more questions. And so I'm seeing one of them here, and I just want to add a little context to it. So one of the things that we do in New York City to make sure that schools are a safe space for everyone in the school building is we have a random COVID testing process. So kids who attend blended learning participate in this random COVID testing. And so one of the questions is around that. And do you have strategies or recommendations for preparing children for random COVID testings at school? The person has tried social stories, but is having a hard time really explaining to their child the importance of this testing for COVID.
Well, part of it is children who, particularly if they have certain developmental disabilities that make them less flexible. So for example, if they have autism spectrum disorder, predictability is really important to them so that they follow the same routine. So just by its nature, something that's random is harder to anticipate and to therefore deal with. So I think what you can do is make sure that the staff in the school understand that and give plenty of notice to the child. So it's not like random drug testing for teenagers that you think are abusing drugs where you can't tell them ahead of time because then they might, you know, change their behavior or do something else or random screening them for drugs on their person. If you tell them I'm going to be checking in an hour, well, then they might throw out what they were carrying that you were looking for. But that is not the case here. So we can certainly tell children with autism spectrum disorder and kids with anxiety disorders that each of us are going to get tested at different points, and we'll tell you when it's your turn. So it's not so much that it's random or anything you did, it's just that you have to wait your turn. And we'll let you know when it is your turn. And then you can show them ahead of time how it's going to be done, what it will feel like. You can even practice it with children who are very anxious about it. So you can go beyond kind of the pictures and scripts and social stories to actually let them hold the whatever swab they're going to use. If they're, I don't know if they're using saliva or whether they placing, you know, a swab in their nose, but you can let them try it. And then also, for some types of procedures we do with kids, we let them hold on to, so that it doesn't feel so much like someone's sticking something into them or doing something they can't predict. You hold their hand too, and you do it together so that they understand what it is. So I mean, any way you can help a child feel less out of control, I think is useful in general. And for some kids, it's really critical.
Do you recommend that families make it kind of like a family trip to go to just maybe one of our New York City testing sites as a family to just have that testing experience together? or, you know, outside of what's required for them from their school?
You certainly can practice it by doing it in that way. The only thing I will say is that there are different types of sample collection. And so if you go to a site that isn't used to working with children, or particularly children with disabilities, and they do a procedure that's much more uncomfortable, you could make matters worse because it may not be that as bad in the school. So I would ask what's going to be done in the school, understand that. And it might be that maybe you have a parent go with the child the first time they're going to be tested in the school or in the clinic, but they may not want parents into the building for infection control. So you might want to go to another site, or maybe you ask for if they have extra supplies, can I stay outside and can I do it the first time with my child? And then we'll hand you the sample. I know, for example, my daughter just went back to New York City. She's a young adult. She got a mail kit and she got the specimen herself. And she doesn't have a disability, but she was concerned that, you know, she had heard how painful and uncomfortable it can be, but then she realized I can order the kit and I can do it myself. My other daughter arranged to get it through a swab of the inside of her mouth. And so there just are differences, and you'll probably want to try and figure out how it's likely to be done in your child's school.
So it's a good idea to reach out to the school, ask, you know, are you using a short swab? What's the method? And then make sure that testing site is going to be the same.
Because I would say, I mean, I got tested for I had a medical procedure that I couldn't have a mask on for. So the hospital had me go in and get it done. And it was done in the back of my throat and a deep swab in my nose. And it was pretty intense, to be quite honest. And my kids are asking me, what does it feel like? Well, one did it herself, and the other one did it in her mouth. And so my presumption for periodic testing of children in schools is they're not going to use a technique that's very invasive or painful. They're going to try and do it in a way that doesn't upset children as much. So I would ask them about what they have planned.
Thank you so much for your time tonight, Dr. Schonfeld. And for everyone who joined, Dr. Schonfeld is going to be joining us through the end of May for this 5-part series. So we really appreciate it. Keep sending your questions or tuning in. I want to share before we go away some updates with you all that have been going on our family website. So I'm going to share my screen with you all and navigate you all like I normally do. So on your screen, you should see the DOE website. On the DOE website, if you navigate to the Learning tab and click on Special Education, one of the first tabs you'll see when you scroll down is Family Resources. And when you click on Family Resources, you'll see the Beyond Access series, and you'll be able to click on this link that says View Upcoming Sessions. And here you'll see all of the dates for our 3 tracks. So you'll see all of our literacy dates, all of our executive functioning dates, and of course, all of our social emotional learning dates. There's also the link to the YouTube page where we upload all of our recordings, including this session tonight. And then you'll also at the top see this link for registering for upcoming sessions. And when you click on that, that takes you to our Eventbrite page that lists some of the upcoming sessions. So for right now, available is all of our February sessions. So you'll see Literacy Session 2, which is next week, Social Emotional Learning Session 2, which will be February 9th. We'll be back with Dr. Schonfeld. And then on February 23rd, we'll be back with Dr. Wexler for another Executive Cognitive Functions. So you can go in, you can register for any of these. You can also click on this follow button to get notifications. As soon as we launch and publish a new registration, you'll see this, you'll get a notification with this. As a reminder to all of you, you'll get an email tomorrow with a link to the recording for tonight's session. Along with that email, you'll also get a link to the survey. So please take a moment and fill out that survey for us. We really appreciate it and appreciate all of your feedback. It helps us plan and prepare for future sessions. And you'll also get the link to the upcoming sessions so you can all register for those. So until next time, have a great evening, everyone. Thank you, everyone. And again, thank you, Dr. Schonfeld.
Thank you.